Good afternoon everyone. My name's Jonty Heaversedge and I'm the Chair of Southwark CCG. I'm incredibly sorry that I can't join you this afternoon to share some of the progress that we have been making as a CCG, but increasingly talk about some of our plans for the future, both within Southwark but also as a system across South East London. Normally it would be an absolute priority for me to join you for the annual general meeting. Unfortunately, unforeseen circumstances have meant that I can't be with you. But one of the great strengths of Southwark as a CCG is the breadth of our leadership across our clinical, lay and executive team. And I know that there will be people there this afternoon who can talk to you both about the work we've been doing but also our plans for the future. And I hope this afternoon will be a really important opportunity not just to share our thoughts but to hear from you regarding the future of the CCG and the work that we do to support health and care across the system. But I don't want to ignore the challenges there have been either. And it won't be a surprise to any of you to hear about the continued financial pressures that we face. Importantly, from my point of view, the response to those challenges has all been about greater collaboration, working much more closely with partners. And again, that's something that I hope will come through in the conversation this afternoon. Whether that's about working more closely with our local authority colleagues as commissioners in the local system, whether it's about the partnerships that have developed between general practices and other providers in the community in the form of primary care networks, or whether that's the incredibly strong partnership now emerging as an integrated care system across South East London. At every level of the system, we have been responding to challenges by thinking about how by working together we can continue to deliver optimal care. And I think one of the things that I've said before, but I would reiterate, is that even if money were no object, it's incredibly important that we recognise closer collaboration will bring improvements that we would want to see for the people of Southwark. Of course, it's easy to talk about working together, changing the way in which we work, but all of that is quite disruptive. And I wanted to recognise that during a time of change like this, it has a significant impact, particularly on staff, who often are the people who most experience some of the uncertainty that exists within the system. And I guess I wanted to pay tribute to the incredible staff that we have, both within the CCG, but also within our provider organisations across health and care, and within the voluntary and community sector in Southwark, because it is their resilience and their commitment to securing the best possible outcomes for the people of Southwark that will ensure that despite all of this change, we don't lose sight of our core purpose, which is about reducing inequalities and improving the quality and outcomes that people in Southwark experience through the care they receive. I hope you have an excellent afternoon, and I very much look forward to seeing you again very soon. Thank you.